Well, hey everybody, it's Sandy and welcome back to my channel dedicated to helping you advocate for your own health one topic at a time. So guys, today I have another video in my dry eye series. I recently had my Lipiflow treatment and I want to tell you about it. Yeah, so first of all, I just want to say thank you and welcome. I see I have a few new subscribers and that's always a delight. And for those of you who don't already know, there is a Facebook page. Sandy's DIY Health Advocacy does have a Facebook page along with a Facebook group that you can ask to join. So head on over there if you'd like to join it. And again, thank you in advance for sharing any content with anybody who might find it helpful or you think would just enjoy it. I so much appreciate it because my goal is to grow my channel. So thank you again. Yeah, so I have dry eye disease and I've talked about it before in a couple of videos. I have a playlist. I believe I have a playlist. I'm going to link it right here. One of the things I try to emphasize when I talk about dry eye disease is that there's no one thing that's curative. At least from my experience, I've learned that the whole is greater than the sum of its parts. So it is a multifaceted thing, just like when I've talked about with COVID. Mitigation comes in all different forms, not just masks. You know, where are you? What kind of ventilation do you have? What kind of mask are you wearing? You know, all kinds of things. So there's all kinds of mitigation efforts. There's also all kinds of things you do to prevent and treat dry eye. Some of these things are daily, and then there are other sort of expensive, heavy-hitting treatments like Lipiflow. There's also IPL, which stands for Intense Pulse Light, also very expensive. So I've done Lipiflow and IPL once in the past. I felt like I got a lot more relief from the Lipiflow than I did the IPL, although I don't have any way to tweeze that apart because at the time, the IPL was a series of 4 treatments, and the first treatment was combined with Lipiflow. So the first treatment was Lipiflow plus IPL, and then there were 3 more subsequent treatments. I believe they were about a month apart each, give or take, and those were IPL only. And I felt like I got some relief, but I felt like I got the bulk of the relief from the first treatment, and that led me to believe that I was getting more relief from Lipiflow than the IPL. Now, the goal is, of course, to buy some time in between those procedures because they're pretty expensive, and you don't want to have to be having those done all the time. So that's where your other mitigation efforts come in, like whatever drops you use or however you clean. Some people do lid scrubs. So I use a new lids device. I've talked about this device before. They do have a coupon code for us. It's not an affiliate link, so I don't make any commission on this, although I have to, the company did after my last video, they sent me some free tips. This uses some disposable tips, so they gifted those to me. That was very kind of them. But I will put the coupon code below. It's Sandy20. This is one of my daily mitigation efforts that I think has gone the longest way. And I'm going to talk about my experience when I just had Lipiflow and something that happened in interaction with the practitioner who was working on me that told me just how well this was working. Yeah, so I went back and looked at the last time I had Lipiflow done, and it was actually about 2 years, almost to the day. So it was October of 2019, and now I just had Lipiflow in October of 2021. The first time I had Lipiflow done in 2019, there was nobody in my area that was doing it, so I had to drive like 2 hours away to another town. Now there is a practice in my area that is doing it, so I decided to go there, and they do it a little bit differently. First of all, I don't believe they do offer IPL, not that I was inquiring about it anyway, but they do their Lipiflow combined with another procedure called Blephex, and they only do those 2 in combination. For those of you who don't know, and you can look at one of my videos, I think the first video where I talked about the new lids device, I talked about the causes for dry eye, but I'll just briefly recap. Dry eye is usually caused by either a meibomian gland dysfunction or blepharitis. There could be other causes, but those are the 2 most common, and sometimes there's a combination of both. In my case, I have meibomian gland dysfunction. I suspect it's from having done 2 rounds of Accutane when I was younger. Dries up a lot of the oil in your skin. Well, these are oil ducts right in here. They secrete an oil that stays on your eye so that the tear film does not evaporate, the more aqueous tear film. And my glands do not produce all that much oil. They produce more of a thick, waxy substance. So some people, the problem is blepharitis, where they actually have debris buildup on this lid margin. And that is why they use lid scrubs and things like that to take those off, to take that off and to keep that biofilm down. Some people have both problems. Now, the new lids device will take care of both of those problems. So Lipiflow is a painless procedure where they put this disposable package of implements onto your eye, and you've got two pieces that hug, like one goes outside and one goes inside, and they kind of hug this lower lid, and one goes outside and one goes inside on the upper lid. I swear it doesn't hurt, and it kind of hugs the upper lid, and you can feel it massaging and warm. It warms up to, I think, like 100 degrees, maybe 102 degrees, and it massages and it liquefies all that oil, and then it physically pushes and massages it out of the ducts. And then when you're done with the procedure, if somebody examines your eyes again in a slit lamp, which they're supposed to, everything is supposed to be empty. So it's sometimes they say, well, you might feel that your eyes are drier for a while because we'll get all of the plugged, thick secretion out of there, and it might be a couple weeks before your body produces enough of that oil again. So in the meantime, you might feel like you're a little too dry because we completely express what's out of the glands. In addition to that, like I said, they do Blephex at the place that I just had my procedure done, and Blephex is sort of like a little handheld, I don't know, I guess I want to call it an exfoliator. It seems to either vibrate or rotate like a zillion times a minute, and they go right over this lid margin and basically exfoliate. Now, I was really concerned about that because, like I said, I've used the new lids device, so I didn't feel like I had a lot there to exfoliate. They assured me it was perfectly safe, and they said that it just really helps you get a better result with the Lipiflow, whether you really need it for blepharitis or not. So I was like, okay, go ahead. So they did that, and that felt a little bit like, it was a little irritating. It didn't hurt or anything. It kind of felt like a tickle. You don't really feel it as much as you think you would. But I had an interesting thing happen, which is that while the optometrist was doing that Blephex procedure, he said to me, you know, your lid margin looks better than just about any I've seen. And I have nothing to attribute that to except for the new lids device, because this is essentially exfoliating that area and keeping it all clean so that the oil glands can secrete as best they can. So I was really happy to hear that. And I told him I use this device, and this isn't a super widely known device, but he said that he knew of it, definitely knew of it, and thought it was an excellent device. And so I just thought it was very gratifying to hear that my effort has paid off and that that lid margin looked so healthy. I have yet to find out how healthy my oil glands are, because they also did some imaging at the time right before the procedure. That imaging gets sent over to my own optometrist, who reads the results and will be able to tell me what kind of shape those oil glands are in, so I'll sort of know how I am going forward, what I might expect going forward. So in the meantime, I continue to use a very layered approach. So hopefully this Lipiflow, I will get another 1 to 2 years. I actually would have ideally had this last Lipiflow treatment done a few months earlier, but in my area there was such a huge wave of Delta that I just felt just doing anything that wasn't absolutely necessary was just too dangerous, and I wasn't willing to do it. And then I also wanted to be a first thing in the morning case, so that meant I was going to wait a little bit longer as well. So it ended up being about 2 years to the day. So I think I would have been better off at about maybe 1 year and 9 months or something like that, maybe 3 months earlier, but I'm hoping for a great result. So far, I feel pretty good. I don't feel like the eye surface area is really dry like they said. I feel like the skin actually on that lid where they did that Blephex, I feel like that's a little bit dry and irritated, and I guess that's to be expected. So I do use sometimes drops just because they happen to soothe there too, or ointment at night. Sometimes I use a little ointment when I'm massaging with the tip on the new lids device. I'll use a little bit of lubricating eye ointment, and I think that helps a lot. But I have to say that the eye itself, it doesn't feel like it's so dry. It feels already a whole lot better. And I don't know what to attribute that to, because they say, like I said, that it might take a while before you build up enough liquid oil to be secreting all over the eye surface. But I think that that might be because, again, this is a multi-layered approach. And another thing that I do for my dry eyes is I take a couple of oils by mouth. So I take an omega-7 supplement, which is sea buckthorn oil. I also use evening primrose oil. Evening primrose oil, I think, is particularly good for this condition because it contains GLA. So if you have fish oil, some people say that fish oil is really good for dry eye. I think fish oil is good for dry eye, but that doesn't have the GLA in it. I think if you're going to take fish oil for dry eye, talk to your own practitioner, because I don't give any individual medical advice on this channel, and nothing that I say should be deemed a substitute for the advice of your own practitioner. But certainly I recommend talking to your practitioner about whether you are a candidate for fish oil. I do take that. But if you are, I also recommend that you talk to them about taking something that has GLA in it, and that would not be the fish oil. That would be something like evening primrose oil, and there are a couple of other oils that are high in GLA. Now, do I know that that's the reason that my eyes don't feel particularly dry right after this procedure and I have to wait like 2 weeks to even feel comfortable? No, I don't know. But I suspect that that is part of it. To a large extent, a dry eye is an inflammatory condition. I know that these oils are also very anti-inflammatory, so I think that they're very helpful all the way around. And yeah, I highly recommend you talk to your own practitioner about incorporating some of these things into your regimen for dry eye treatment. I will say that based on my experience, if my experience is at all typical, this is not about just one thing. For me, having occasional procedures like Lipiflow, which I think is fantastic, feel like I could have lived without the Blephex. Using the new lids device, using some ointment sometimes, ingesting the oils. I think all these things are really helpful. So I was just really excited to hear from that particular practitioner just what my eyes looked like to his naked eye in terms of doing the lid margins with that Blephex. I was really excited about that. And I know that that has to be because of the new lids device, because I hadn't heard that before. The last time I had any of these procedures done, I didn't have Blephex, but I had both IPL and Lipiflow. I hadn't heard anything remarkable like that. I was still being told to do a lot of hot compresses. I have trouble with the hot compresses. I just don't like how blurry I get for a while. The cornea does sort of change shape for a while after a hot compress. I'm not saying don't do them. But this time I wasn't told that I really have to do that because these other mitigation measures seem to be working in combination with one another. So I was really happy about that. Now I will keep you guys posted. I don't go to my own optometrist again for another 6-ish weeks for my follow-up, and that's when he's going to tell me what that imaging looks like. I'm just so anxious to find out about that, and I really hope that I have some healthy meibomian glands, because I'm pretty sure some of them have died off. These do die off if they stay blocked long enough. I have a couple that I know are scarred over, one over in this corner, by the way. So I'm hoping that I get some good news on that, because of course I would like for my meibomian glands to be functioning now that I have all these tools in the toolbox to help facilitate the oil secretion. So let me know if you guys have tried any of these things. Let me know if you've tried Lipiflow. Let me know if you've gone ahead and tried the new lids device. Again, use the coupon code if you do. And let me know if you have any other things in the bag of tricks that I haven't mentioned. I'm always interested in adding something to the bag of tricks of dry eye mitigation strategies. So let me know if this was helpful, and until next time, be well. Bye-bye.